Hello, my friends, and welcome to the Pathway channel. Today we will discuss the nodal marginal zone lymphoma. And this is a core biopsy from a lymph node. And from the low power, from the 2x as we used to do, we need to see whether we still have any preserved architecture for the lymph node or not. And from this power, I can say that we can have vaguely nodular appearance for this lymph node. But from this power, I can see that we have this monotonous or kind of bluish cells that are infiltrating or they are present all over the lymph node. From this low power, it's difficult to detect whether we have any large cells or not. So we will need to go on a higher power, but at least we can say that we don't have any weird appearance. I will go on a higher power. Here we are at the 20x, and as you can see, we don't have any different looking lymphocytes. They are all the same with this dense chromatin. This is now on the 40x, and again, without changing this field, you can see that you have these nuclei, and some of them, this is a plasma cell. Some of them, they have the plasma cell differentiation. And for this, our differential diagnosis may be the marginal cell lymphoma or the lymphoplasmacytic lymphoma, though the LPL, it's rare to happen in the lymph node. With some stains, we will be able to differentiate the indolent lymphomas, whether it's CLL, SLL, or it's mantle cell lymphoma, it's marginal, it's follicular, it's lymphoplasmacytic lymphoma. So we will need to go through several stains to differentiate. But let's agree on one thing, that we have small cells or small to medium size cells, and they have this plasma cell differentiation. I will go around, maybe we will find any different findings. These are just blood vessels. The background here, I can't see any inflammatory cells in the background, just the same shapes or the same lymphocytes that are infiltrating all through. And here is the same. So I will take it step by step, and I will go with the immune stains. For the immune stains, I go on low power to see the staining pattern. And this is the CD20, which stains the B cells. So from this view, we can all agree that this population of monomorphic cells, they are B cells, not T cells. And let's go for the T cells or the T cell stain. So we will go for CD5. So for the CD5, we can see that we have some staining, like here, but this is very small amount of cells staining this CD5. So these are the T cells, but the majority of the cells, other cells, they all stain negative, which already stained CD20. So these are the B cells, which are the cells that we are concerned about. So for this, the cells, they take the CD20, they are B cells, they are CD5 negative. And saying CD5 negative will exclude the CLL, SLL, and will exclude the mantle cell lymphoma. This is the BCL2. And as you can see, it's diffusely positive all through the lymph node. So for sure, we have something wrong going on with this proliferation. Let's go now for CD10, because the marginal zone lymphoma, it's negative for CD10. And I hope you can appreciate that this population of cells, they are all negative for CD10. So now we have CD20 positive B cell, CD5 negative, CD20, CD10 negative. So we are at marginal or lymphoplasmacytic lymphoma, though the LPL is rare to happen in the lymph nodes. Let's exclude also mantle cell 100%. This is the cyclin D. It should be positive if this is a mantle cell lymphoma, and here it's all negative. Let's see if we have any restrictions, whether lambda or kappa. And this is the lambda stain. Please remember this figure. I will put the kappa 1 to compare. This is the kappa stain, and I think they all look the same. So this is polytypic, or it's non-contributory in this case. I will go extra for CD23. It can be positive in like 20% of cases of the marginal zone lymphoma, and here it is positive. Now let's go for the Ki to see whether this is the proliferation index of this one. And this one with the diagnosis, we put low proliferation index, like around 10% or 5 to 10% in these in this lymphoma. And this is the germinal center, which is normal to have this dense Ki 67 activity. This is the BCL6. This is for the germinal centers. As you can see here, very few cells, they are taking the stain. Otherwise, the whole tissue is negative. If the diagnosis for this case, it's a CD5, CD10 negative B-cell lymphoma, and we will say that this is consistent with marginal zone lymphoma. Thank you so much for watching the video. I hope you like it, and please watch the other lymphoproliferative disorder videos to compare and to learn more about the staining. If you like the video, please like and please subscribe to our channel. Thank you.